Okay, thank you. Good afternoon, everyone. And thank you, ma'am, for giving me the floor. And I'm extremely happy to join your seminar because I think this is the best thing that you can do during the webinar, during a crisis like this. Thinking how you can invest in surviving, getting through this deep crisis in the best way, but also to make sure that nutrition is included in every action because it is keeping people alive and people healthy so that they can recover at a certain day and build a future. I would like to make 4 remarks during the opening, and I'm extremely happy to join during the whole webinar to listen in and eventually also answer questions. First of all African countries are thinking about how to get through the crisis and how to prevent this COVID-created crisis to be as soft as possible, impacting not too negative. But at the same time, many governments, but also other stakeholders are thinking, how do we recover from here? And I would like to encourage everyone to do this. Start thinking about how good food and nutrition can not only support you in making it through this crisis, but also how to recover from it and how to build back better. So share lessons during this webinar. Make sure that you have the right sectors around the table, not only, of course, the Minister of Health, not only the Minister of Agriculture, but also Education, Social Protection. The Ministers of Finance are represented here, and that is key. Because investing in future is investing in people, and investing in people is investing in a prosperous future. So this is of key importance. The second remark that I would like to make is that we can observe already that only by working together within countries, different sectors, but also with different stakeholders, civil society organizations, UN organizations, donors and investors, but also the private sector, a country will be able to recover. And then you sort out that only by working together and bringing the change that is needed to rebuild resilience to a country, to bring the quality of food and nutrition to the level where it needs to be, it requires systemic change, building upon the collaboration and working together. And for this reason, it is very good that ODA, NEPAD, CABRI and the Sun Movement have already joined forces, and that also other partners are stepping up to come together and to bring the change that is needed also to create a prosperous future. I would like to applaud the African Union for taking already an initiative to do this. Thinking about how to build back better, and this is my third remark, the African Union Commissioner, Her Excellency Josefa Sacco, together with some colleagues, has organized a high-level meeting on the importance of food and nutrition. Now, I have to admit, nutrition was not that strongly reflected in this meeting. The focus was very much on food, but right now, the commissioner, but also the working group, the task force, is opening up to include nutrition. And that is the remark I would like to make here. Many people in Africa, but also in Asia, and decision makers in Latin America, and also in Europe and America, in the United States, they do not really understand the crucial importance of nutrition. And sometimes they think that food security and nutrition is the same. I think it is crucial to underline here, to emphasize here during this webinar, that food security is about calories, but that calories are not building the resilience of people, that calories are not investing in the right smartness of people. There you need nutritious, healthy, diverse food with the right minerals, the right vitamins, and the right components. So it is not only the amount of food, it is the quality of food, it's the nutrition that is investing in the resilience of the body of people, but also in the smartness, in the cognitive development of people. And we all know that the first 1,000 days of a child from conception until the second birthday are of crucial importance for the development of the cognitive infrastructure, the brain infrastructure, and that children who are well nourished are smart school kids, that they are able to learn better, but also later on they are more productive, they are more solution oriented, and they are able that if their family is in poverty area, to escape poverty and to contribute to a happy and prosperous family, but at the same time also to support the development of a prosperous country, a prosperous society. So this is my fourth remark. Make sure that the focus is on nutrition and work with the African initiative to make sure that African countries get through the crisis and build back better, not only on food security, but including nutrition security. Finally, you are not alone in this. The Sun movement is in different regions, Asia, Africa, very strong. Most of the African countries are a member of the Sun movement, but also in Latin America. And together we will prepare per country for the Food Systems Summit that the Secretary General of the United Nations will host somewhere next year. Countries are requested to sit around the table to think about the future of their food production system, the food value chain, but also about consumption. Because this COVID crisis is learning us that people who are undernourished, but also who are obese or are obese, are more vulnerable to this virus. So resilience needs to be built, and it can be done through food systems. So food systems that are healthy, nutritious, and at the same time also sustainable when it comes to natural resources, biodiversity, and climate change. We are ready to work with you. Please focus on it, because it can create a prosperous future for many, many African countries, if not all. Finally, and that is closely connected, the Olympic Games are postponed. As we all know, they would be organized as we speak. They would start as we speak in Tokyo. They are postponed with 1 year. But at the same time, the government of Japan has taken the initiative to connect it to the Olympic Games, also organize a Nutrition for Growth Summit. And there they also want to have commitments, nutrition commitments from country. Now, as Sun Movement, we think that the Food System Summit and the Nutrition for Growth Summit are excellent, excellent opportunities for all participants to this webinar and many, many more to make concrete, measurable commitments to invest in a better food systems that is serving the nutrition of people, and at the same time serving our planet by biodiversity, by mitigating or adapting climate change, and at the same time by safeguarding natural resources. And with this, I hand back to the moderator, and I will participate, and I'm eager to listen to the conversation and contribute if so desired. Thank you so much.
Merci Gerda pour ce discours très inspirant. Alors pendant 3 minutes, je vais essayer de faire le maximum pour donner le contexte financier, la nutrition pour l'Afrique en général. Et après cela, on va laisser la parole à Kabri pour la suite. Next slide, please. Next slide, please. Merci beaucoup. Alors, j'ai résumé mon point en fait en 4 principaux éléments. Tout d'abord, il faut savoir en fait de quoi on a besoin. Alors, en termes d'estimation de ce qu'il faut pour la nutrition, la Banque mondiale en fait a décrit un cadre d'investissement global de la nutrition en 2016 qu'il faut donc revoir parce que le Covid a eu un impact bien sûr sur ces données-là. Et ce cadre en fait d'investissement donnait comme élément d'information qu'il fallait 2,7 milliards par an en Afrique via les budgets nationaux et en santé notamment pour avoir une espérance d'atteinte des cibles de l'AMS à 2025. En principal en fait nous avons l'émancipation et le retard chronique. Il faut aussi à côté plus d'investissement dans tous ces secteurs sensibles, à savoir l'agriculture, l'éducation, la protection sociale. Ça, c'est la théorie. En face, il y a ce qu'on a comme réalité. D'abord, il est dû d'avoir les efforts sur les financements en fait, des États pour des raisons simples. Il n'y a pas tous les États en fait, en Afrique qui font un tracking budgétaire de leur financement de nutrition. Et quand il y a des informations, en fait, on remarque qu'il n'y a pas beaucoup de décaissements. Et quand il y a des décaissements, en fait, c'est très souvent ciblé dans les secteurs qui ne sont pas souvent en fait, relatifs à la nutrition. Quand nous parlons aussi du Covid, en fait, ici, l'impact, il est assez simple comme impact. Je pense que l'écran, il n'apparaît pas, c'est pas grave. L'impact du Covid, en fait, il était plus ou moins assez important dans différents pays, puisque la plupart des pays n'arrivent pas à mettre en œuvre le plan de nutrition. Et à côté, il y a aussi beaucoup de réponses de bailleurs, des UN, en fait, pour essayer en fait, de mitiguer la crise. Et ce faisant, il y a aussi donc une urgence maintenant pour les pays africains du Sun, en particulier les pays en fait aussi d'Amérique latine et d'Asie, d'avoir aujourd'hui, à ce jour-là, une estimation de l'impact du Covid sur les financements, donc sur les déficits en fait existants, quelle est la vision en fait à court terme et long terme des budgets, et comment est-ce que, avec l'appui des bailleurs et différents réseaux en fait du Sun, Nations Unies et acteurs civils, on pourra essayer de mettre en œuvre la mise en œuvre des projets de nutrition. Pourquoi c'est important d'avoir une estimation aujourd'hui? C'est parce que d'ici 1 an, l'a rappelé Mme Gerda Verberg, nous avons des engagements à faire, à prendre au niveau donc, du Sun, au niveau des pays du Sun, des pays en particulier, des engagements qui sont dans le sens d'avoir plus de ressources domestiques mobilisées. Donc aussi, en perspective avec le sommet de la nutrition au Japon dans 1 an, et aussi tout ce qui est système alimentaire. Pour ce faire, il est urgent qu'il y ait une bonne coordination au niveau intergouvernemental, aussi intragouvernemental, mais aussi il est aussi important qu'il y ait une coordination régionale assez renforcée. Donc c'est un peu le but de ce webinaire-là. On espère que tous les acteurs qui ont participé à ce webinaire par la suite, les panélistes, pourront donner un peu plus d'exemples sur ce cas-là. Sur ce, je passe la parole à Kabri pour la suite. Merci à vous. Over to you, Daniel.
Thanks so much, John. So yeah, the Collaborative Africa Budget Reform Initiative is an intergovernmental organization working with ministries of finance across the African continent and selected line ministries, including water, sanitation and hygiene, health, agriculture, and looking for ways to improve public financial management and government's resources, management of government's resources. And as John has alluded to, that we need more resources, obviously, but in addition to that, we need to make sure that these resources are managed more efficiently and more effectively. And this is where the public financial management system comes in to support attainment of nutrition targets. And very briefly, I'll run you through how the PFM cycle, from budget formulation to accountability, tries to support attainment of nutrition targets. So the first area we started with budget formulation, and this is where you try to translate political commitments on nutrition into implementable nutrition projects. However, what's very clear is that throughout the continent, linking plans and budget hasn't worked very well. And then the next stage is budget approval. And this is when things become very political. And you need to convince parliamentarians of the importance of investing in nutrition. And that's making sure that you understand the investment case for nutrition. But what we're seeing at the moment is that both budget formulation and approval are taking place more than once a year. And countries are having to pass supplementary budgets and adjustment budgets in response to declining revenues and increased expenditure related to COVID-19. And that's leading to difficulties within budget execution. You're having to shift around, and delivering on the approved budget becomes even more difficult because you have rigidities in your PFM system and you have lack of absorptive capacity at the line ministry level. So we're seeing various problems within nutrition from that perspective. And it's re-emphasizing that what we really need is strong, flexible PFM systems during this time, capable of delivering, but also promoting accountability. And the accountability is really the last phase in the PFM cycle. And it takes place after the financial year, when your supreme audit institution and hopefully also your legislature looks at where the nutrition spending was undertaken equitably, efficiently, and effectively within the accountability framework. And this is where it becomes really important, given priority sectors like nutrition, that your citizens and your civil society hold government to account and ensure that spending is done equitably, efficiently, and effectively. Thanks so much. I'll now hand over to Bibi, another co-organizer from NEPAD, who will run us through what their position on this matter. Thanks, Bibi. Over to you.
Thank you very much, Danielle. Thanks, everyone, and a very good morning, good afternoon, good evening, wherever you are. I'm happy to just say, let me just start by saying, of course, we know that NEPAD, African Union Development Agency, is the foremost development agency for the continent, looking at how programs can be financed, how programs can be invested on, and how they can be executed. So, in the context of COVID, I would just like to underscore that in terms of budgeting, in terms of putting any resources forward, there has to be a common understanding of the priorities that needed to be funded. And then secondly, there needs to be clarity on sectoral contributions, noting that nutrition is multisectoral, therefore all the different players have to come to the table. Moreover, in the context of COVID, in spite of the fact that it may appear that it is a health or medical issue, it actually is a multisectoral, cross-cutting issue that affects all spheres of existence. So, what countries and regions have done and continental level, countries have set up funds, Africa has set up a COVID fund, in view of being able to change and review the existing pipelines so that we can reprioritize and via funds to other actions that are necessary to take at the point in time. Some of the challenges include, when you have a lockdown, you very well know that businesses are not running. So there are no tax revenues. So, and that being the case though, there's a heavy focus on health and medical aspects, dropping the other aspects of society, economy, that we know it to be important. Given that challenge though, we also have realized that the lessons to learn very deeply, very intensely are that countries have been able to mobilize resources internally because everybody is looking outward. There's no more foreign direct investment. And then also the other lesson we are learning is that because of the systemic dysfunctionalities, we have to relook at how we can design and redesign our governance issues. And then we have to make sure that the inefficiencies that have been there are dealt with without risking the medicalization of nutrition and ensuring, as Danielle said, transparency and accountability. Let me just give one small example. When the COVID started, Botswana, even though it is not a CABRI member, well, nevertheless, a member of the African Union and a member of AUDA, Botswana decided that they were going to ramp up their social program schemes. They were going to be supporting small businesses and ensuring that the preparedness for forward planning is in place based on their original early warning systems. So integrated program and budgeting, giving the example of home school feeding and the primary health care. So if we were to attend to COVID and nutrition in a holistic manner, I think we have lots of lessons to learn from the past and we should carry those forward. Let me stop here and carry forward and invite Neil. Over to you, Neil.
Thank you very much, Baby, and thank you, Gerd de Verbe, for joining us on your holiday. I think your comments that you provided set the scene for the rest of the webinar, and thank you to the partners Sun, Cabri, and NEPAD AUDA for complementing those very important messages from Gerda. So my name is, and I will be the moderator for the panel discussion that will now be undertaken. And just to also say good morning, good afternoon, and good evening to the many participants across the globe. I see that we have currently about 145 participants, and we're really pleased that you came to join us. So the panel discussion will comprise of 5 panelists. Our panelists will respond to a set of questions that I will pose to them, and they will do this either verbally or through a presentation. And what I plan to do is to introduce the panelists just before they're going to respond to the questions that I will put to them, or just before they provide their presentation. So our first panelist is from Mauritania. He is Abbas Sela. He's the Director General of Development Policy and Strategy in the Ministry of Finance and Economy. He is also Mauritania's government focal point to the Sun movement. So Abbas, welcome. And I would invite you to respond to the following set of questions. So I think the one important one, how nutrition has been integrated into the new national response plan against COVID-19. And then the second question, how the government has mobilized to support nutrition actions during this COVID period. And then the third question that I'd like to put to you is, what was identified as the financing gaps, and what actions were undertaken to try and address these financing gaps? So Abbas, over to you.
Merci beaucoup. Bonjour à tout le monde. Je suis très honoré de prendre la parole en tant que panéliste autour de cette problématique de financement de notre nutrition et parler de l'exemple ou présenter le cas de la Mauritanie. Alors, comme vous le savez tous, on a été pris de court par l'ampleur de cette pandémie et il était tout à fait naturel que le gouvernement, dans un élan fort, il a été amené à mettre en place un plan de riposte multisectoriel pour le Covid, donc pour juguler un peu les effets de cette pandémie. Il est tout à fait naturel et compréhensible que vous comprenez très bien que, vu l'urgence sanitaire, l'accent a été mis d'abord sur les aspects de prise en charge de cas malades. Et c'est à ce titre que peut-être un peu l'aspect de la nutrition a été relégué pour un second cycle de ce plan de riposte Covid, parce que les autorités avaient pensé ce plan pour qu'il soit un plan dynamique et glissant, pour tenir compte un peu de l'évolution de la pandémie et d'autres problèmes qui peuvent venir se greffer. Et il faut dire aussi que ce nouveau plan de la nutrition pour nous, a été intégré grâce donc aux acteurs multipartis de la nutrition, en particulier notre société civile qui est très active, et en particulier aussi le rôle que joue le secrétariat à Genève certainement à Genève, mais toujours présent à notre côté. Et tout particulièrement les retombées de la visite de Madame pour nous aider à conduire ces plaidoyers auprès des autorités, c'est qu'elle a réussi parfaitement. Et les engagements qui ont été pris par les autres autorités, en particulier le président de la République, pour faire de la nutrition un axe de planification dans tous les départements, vu son impact sur les capitales humains. Et à ce titre, je tiens à la remercier pour son action quand il était là, et dire surtout à ceux qui pensent encore que notre mouvement est superflu, c'est grâce à la visite des jardins que la nutrition a connu cet élan dans mon pays. Donc, ce plan s'articule rapidement autour de 4 actions. Une prévention et un traitement de la malnutrition aiguë pour les enfants et les femmes enceintes, une supplémentation nutritionnelle et référencement de prise en charge des cas de malnutrition aiguë, sévère et modérée, une prévention de la nutrition aiguë, et enfin la promotion de pratiques optimales d'alimentation des FEFA et des nourrissons et jeunes enfants. Alors, pour ce qui est de la troisième question, excusez-moi, je vais aller peut-être rapidement parce que le temps me presse, je n'ai que 4 minutes. Le gouvernement s'est mobilisé pour la nutrition à travers 3 axes principaux. L'assistance alimentaire, donc à travers des distributions gratuites au profit, par exemple, de 100 ménages pour 4 mois de produits alimentaires, de distribution pendant 2 mois de produits alimentaires pour 133 ménages identifiés vulnérables, mais que le Covid et le confinement va très probablement faire basculer dans l'insécurité alimentaire. Plus de 10 000 tonnes de poissons qui ont été distribuées à travers tous les pays pour tous les ménages. La distribution aussi de produits alimentaires pour les mosquées et les écoles coraniques. Au niveau de la poursuite des services essentiels, donc il y a eu l'ouverture de 1000 Kranam, l'achat et la préposition de fournitures intra-nutritionnelles, la réduction des fréquences de visite de 2 semaines pour les Kranam à 1 mois, la fourniture de rations pour 2 semaines, et ainsi de suite. Parallèlement à ces activités, donc au niveau des NASM, au niveau des NAM, au niveau communautaire, ce relais a été assuré par la société civile qui joue un rôle extrêmement déterminant, celle en tout cas qui a été formée au niveau de l'impression, et elle a joué ce rôle de relais au niveau communautaire. Et le dernier axe sur lequel on avait intervenu, c'est surtout au niveau du renforcement des moyens d'existence à travers du cash transfert au profit de près de 300 000 ménages pendant 6 mois, la mise en place de 600 AGR en milieu rural, la construction de stocks de sécurité de céréales, de stocks de sécurité aussi d'arrêts alimentaires de première nécessité, et d'autres actions telles que l'exonération en 6 mois d'importation de produits alimentaires, la prise en charge de l'électricité, et ainsi de suite. Ça, en fait, ce sont des actions à travers lesquelles le gouvernement a essayé de traiter de malnutrition. Alors, au niveau des gaps, je pense que c'est le plus important, le gap et les difficultés. Vous savez, quand le gouvernement a mis en place ce plan Covid, qui est un plan qu'on a voulu participatif parce que l'ensemble des parties prenantes ont pris part à la conception de ce plan, on l'a présenté aux bailleurs de fonds, aux partenaires de la Mauritanie ici présents, dans le cadre de ce qu'on appelle le comité de veille économique pour la réponse au Covid, que préside le ministre de l'Économie et des Finances. Et les partenaires, tout naturellement, sont annoncés pour aider à mobiliser les financements nécessaires. À ce jour, notre plan de riposte global, il est de 646 millions d'UGIA. On est à un niveau de financement acquis de près de 55%. Et sur ces 55%, l'État mauritanien a mis de ses propres ressources 20% sur le budget de l'État pour financer ce plan Covid. Il reste naturellement un gap de 45% sur lesquels certains pays se sont annoncés pour éventuellement compléter ces financements. Il s'agit de la France, de l'Angleterre, de l'Espagne, de la Banque mondiale, de la BAD, de l'Union européenne, du BMZ, et certains partenaires à travers le PAM et l'UNICEF, surtout à travers un financement d'IBMZ. Mais j'aimerais surtout dire que pour ce qui est spécifiquement de la nutrition, notre plan de post-nutrition, il est de 17 millions de dollars. Et jusqu'à présent, les financements mobilisés, ils sont à près de un peu moins de 3 millions de dollars. Et donc, vous voyez que le gap, il est de 14 millions. Et donc, c'est à ce niveau que l'effort devrait être fait. Et je pense que dans les semaines à venir, avec toutes les semaines, en fait, on fait une réunion et avec l'appui aussi du système des Nations Unies, le coordonnateur, qui coordonne la partie partenaire au développement. Donc, ils sont régulièrement informés des besoins et surtout de l'évolution pour organiser ensemble la mobilisation des financements pour la nutrition. Donc, voilà en gros ce qui a été dit de manière assez ramassée et bref. Je suis désolé si j'ai débordé un peu sur le temps, mais je suis prêt à répondre à des questions précises au cas où les différents participants souhaiteraient avoir un peu plus d'informations sur l'expérience du cas mauritanien. Je vous remercie pour votre attention. Merci beaucoup.
Thank you very much, Abbas, who is from the Ministry of Finance and Economy in Mauritania. Our next panelist is Ernest Obe, who is the head of the Agriculture Division at the ECOWAS Commission. And Ernest will be making a presentation, and in his presentation, you'll be covering the following. So what national governments need to proactively finance and efficiently and effectively implement nutrition programs. How is the ECOWAS Commission, as he represents an economic community, how is the ECOWAS Commission helping its 15 West African member states to ensure that nutrition remains a priority and that cross-border trade of food and agriculture inputs does not provide a threat to food security? And then lastly, he will also deal with how the Commission is ensuring that nutrition outcomes remain affordable in its member states. Thank you, Ernest, and over to you.
Thank you very much, colleagues. Thank you very much, colleagues. I want to go quickly through this presentation on behalf of the ECOWAS Commission. I have 4 minutes. Can we go to the first slide? Okay, in terms of the response to the COVID-19, the ECOWAS Commission has put up a number of coordinating mechanisms, starting with the heads of states and government, and also at ministerial level, we have various task forces coordinating the regional and national responses. Now, the principal objective is to save lives, is to ensure that we provide support to vulnerable populations and groups. We are also trying to work to ensure that we cushion the effects of our local and national economies and to come up with relevant social safety nets. Next slide. Yes, in terms of mainstreaming nutrition and cross-border trade of food, the Commission has been working even before the COVID-19 pandemic. We've been working on integrating nutrition security in the ECOWAS Agricultural Policy, ECOWAP 2025, in the Regional Agriculture Investment Policy for Food and Nutrition Security, and also the National Agriculture Investment Plans of the 15 member states. We have also put in place a COVID-19 response plan for the entire region, which is cross-cutting in terms of addressing health situations, food and nutrition security, social protection, livelihoods, and also the issue of policy advocacy and awareness raising of COVID-19. To show that ECOWAS takes the nutrition and the general COVID-19 response very seriously, we have identified a champion in the passing of the Nigerian President, His Excellency President Muhammad Buhari, for ease of coordination of the plan. Next slide. Now, The first thing we had to do to capture food and nutrition issues is that we had to realign our 2020 departmental budgets. That is the budget of the Department of Agriculture, Environment, and Water Resources. We align it to ensure that we focus on key food and nutrition concerns at the regional level and at the member states. There was a summit meeting of ECOWAS agriculture ministers, and they identified the priorities which the Commission should pursue. We are also doing a lot of policy advocacy on global, continental, and regional nutrition agreements and directives that we have signed over time. And we have also been doing a lot of partnership and resource mobilization to develop new initiatives. And the most current one is the Food System Resilience Program, which has a very strong nutrition security component. This is presently ongoing with the World Bank. As I speak to you, there is another webinar taking place with the World Bank, with our regional bodies like SEALS, CORAF, and UMOA, and development partners. Next slide. Now, my second question was about how do we make nutrition outcomes affordable in our member states. In this regard, we have taken a number of initiatives. One is to continue with policy advocacy with the member states to tell them that it's not just production, it's not just food security, but nutrition security, as was said by the keynote speaker, is very critical. And this must be targeted at the most vulnerable people and the poor in particular. We are also emphasizing on the issue of food safety nets. Food safety nets at two levels. At the level of the region, we have food grain reserves, and also in the member states. Most countries are trying to increase their food stocks. And most importantly, also, we have modify in the sense that the children are not in school at the moment because of COVID-19. How do you reach out to them? The third portion is encouraging small ruminants and local vegetables that most of the time in food security programs we tend to ignore. But I think small vegetable gardens, small ruminants important role in food security a pandemic period. Countries and ECOWAS has a solidarity for food and nutrition security. We must invest. And in this regard, we had taken commitments from Malabo over a decade ago to Maputo. We must invest in nutrition as a region and as individual member states. And finally, we are working as a commission with the member states to ensure that for the current rainy season, the farming season, countries are provided with agricultural inputs and the necessary support services so that the 2020-2021 farming season can be a successful one. Because if it is not successful, if it's not productive, it will compound the problems of COVID and food and nutrition insecurity in our region. Next slide. Okay, I think this is the last one, and thank you very much.
Thank you very much, Ernest, from ECOWAS for dealing with those very important matters that concern 15 countries working within a regional economic. Chwani Lekomola Danzige, who is the budget controller of a national budget at the Ministry of Finance, Lesotho. And it's also worth mentioning that Lesotho is the current AU nutrition champion. In her verbal response, Malema areas, two questions. The availability of funding for nutrition been affected by the pandemic, and how will it be affected with the likely and maybe already and also coming from the Ministry of Finance, in what ways has the public finance management system in Lesotho helped or hindered the implementation of nutrition programs? Doing that there is adequate funding for nutrition projects that are being implemented, and also
Neil, you're going to have to turn your camera off. Your bandwidth is very low.
Okay.
We can turn to Malishwane though.
Malishwane, you on mute?
Okay.
Great, thank you.
Thank you very much, Neil, and thank you, Kabri, for inviting me to be one of your panelists today. I must mention, maybe first of all, that our SACU revenue this financial year did not go down. It remained as it was projected. However, our tax revenue was the one which was revised down. Therefore, there was some negative impact on the expenditures that were projected for this current year. When the pandemic arose, the government sat down to look at the impacts of the COVID-19, and they came up with some, or we came up with some economic and social mitigations, including issues of food security, insecurity, and the nutrition security. We also, as the Ministry of Finance, began the process of reallocation. We reallocated an amount of 1.2 billion, which would be used, which would be reallocated money that could address the issues of food insecurity, such as government is intending to implement the agricultural food subsidies, agricultural subsidies to increase food production and nutrition situation and households' food security, whilst maintaining the right level of grain reserves. We are also looking at the vertical expansion, which looks at increasing the cash benefits amount for existing beneficiaries, that is top-ups, especially the child grant that the government is already having. We also have the horizontal expansion for public assistance. We are going to pay the already people who are vulnerable they are going to get 900 maloti for 3 months. We are increasing the coverage from where it was before. And the Ministry of Social Development has just added new beneficiaries of vulnerable groups amongst children, elderly aged 60 to 69, since our old age pension was from 70 upwards. So the 60 to 69 will also benefit for 3 months. People with disabilities and those in the informal sectors to benefit only during the pandemic. That is the 3 months, to ensure that they do not fall into poverty trap. This horizontal expansion has been successfully implemented for the 3 months. That was May, June, and we have just about to pay the last month. We continue with our school feeding program. it is expected that monthly rations will be given to vulnerable children as identified by the schools and the communities. And this will continue through the schools. This will continue. Those schools are now currently closed due to the pandemic as well. Last year, 1920, we were hit by the drought, and the COVID-19 pandemic now continues to hit on the food insecurity. So from last year, we were under severe food insecurity. With this COVID-19, it exacerbated it. So we continue with the humanitarian assistance that was budgeted in 1920 to be made available. This will be made, that amount of money will be made available so that it could be, the exercise could continue. Also, there is under 5 feeding. The Ministry of Health will continue with the therapeutic feeding program that they do for the under 5. We also have tried to subsidize the salaries for the industrial workers, as we know that during the COVID-19, people are not working, therefore they're not getting any salaries. So the government will do this for 45,000 industrial workers for 3 months. This as well has been implemented properly, and this July is the last month of that. And there is another provision that was given to top up the stipends for the students who are abroad and those who are local and in the region, the Setec region, will be given some stipends to top up whatever they were getting, so that they are not suffering from where they are due to the price hikes that may be seen because of the COVID-19. The Ministry of Finance, however, took longer to reallocate the money, and hence some of the activities were delayed. But since reallocation has now been approved, disbursements is about to go to address the issues of the nutrition in the country. In the case of our donor financing, we have World Bank funding, which has been prioritized, and they have promised 40 million not US dollars, it's 4.4 million US dollars of grants that is in the pipeline and planned to be effective by August, September this year. We also want to fully take advantage of the donor support, which is also underway. We want to fast track the project of nutrition, which is under the Ministry of Health. We also want to strengthen Food and Nutrition Coordinating Office, whose main role is to coordination, so that the coordination of nutrition, so that the relevant line ministries and partners are harmonized, their efforts are harmonized. And in this case, collocation of interventions towards severely affected population is more appropriate. In the medium term, unlike currently, relevant line ministries should organize their respective budgets so that expenditure in nutrition is specific and sensitive, because right now our nutrition budget is not clear as to how it is budgeted for and which ministry is actually budgeting for. We have money which is not even traceable in the Ministry of Agriculture, in the Ministry of Health, and in the Prime Minister's office where FNCO is housed. With this, thank you very much, Nia.
Thank you very much, Malishwani, and also thank you for answering one of the questions that came through, and that question was, do you have a separate expenditure line or program where one is able to see what the Kingdom of Lesotho budgets for nutrition? And also thank you for sharing quite an ambitious program that you are going to be putting forward as Gladys Mugambi. Gladys is Head of Division of Health Promotion. She's also the Sun focal point for Kenya. And she's based in the Department of Primary Healthcare in the Ministry of Health. Gladys will be responding verbally to the following questions. I suppose the first and obvious one is a question relating to this triple threat that Kenya faces at the moment with COVID-19, the locust swarms that have attacked, and also cases of flooding. So how has the Sun multisectoral platform addressed this triple threat, Gladys? And then, a question on the health sector's budget. I mean, how has that been affected? Have you been able to reallocate funds from other areas in support of COVID-19 responses? And then the final question, in terms of planning and financing, what are the long-term implications for the government of Kenya? Gladys, thank you.
Thank you very much for inviting me also to be in this panel. And as you said, Kenya has faced, I would say, triple burden of disasters. We've had floods early in the year. We've had locusts, which have not cleared yet. And now we have COVID. So when COVID came in, we as a country have always had a contingency plan based on the surveys that we conduct, the short range assessment and the long range assessment. And we had a contingency plan that the multisectoral team came together and reviewed so that they could include the response to COVID. So after that, we were able to come up with key guidelines from the Ministry of Health and from Ministry of Agriculture to actually educate people on what they need to do in terms of ensuring that they are food secure, and also to continue practicing good nutrition to the children, to the mothers, to the people who are vulnerable and the aged. So this was released during the usual updates that we have on COVID, and the media have continued to communicate on the same. So also we continue to include issues of food security and nutrition in the surveys that have been conducted, and the Kenya National Bureau of Statistics is about to release a report on the same. So we've used the systems that had been developed before to ensure that we monitor the status of nutrition of our children and women. We have the Kenya Health Information System, which is where we get information on how our children are in terms of whether they are facing hunger or there is any issue that we need to address. So as we know, we must use the multi-sectoral approach. There were resources already allocated to the Ministry of Education to feed the children in schools. Unfortunately, our schools were closed, and I think they'll be closed for a longer time. And therefore, the resources that are available are being reallocated in the new financial year to focus on issues of COVID. And maybe that also answers the question on how the Ministry of Health has been affected. Basically, all the other ministries have been affected because health has to be supported so that the resources can be used for response to COVID. This is at national level and also at the county level. Most counties have to put resources into ensuring that they are adequately equipped for COVID. And therefore, there is a likelihood that you'll find the activities for nutrition and for food security are affected. Meaning that even the Ministry of Education will be affected and the Ministry of Agriculture. Meanwhile, the Ministries of Agriculture, Education, Social Protection are working together to ensure that the response is continued even with minimal resources. As we know, our partners and donors have reduced funding to Kenya. And therefore, the way forward is to ensure that Kenya has budget lines for nutrition across all sectors. We've been increasing slowly, and we hope that this will happen as we move forward. In terms of food security, food safety, and nutrition, we've been having continuous updates to the public concerning what they need to do in terms of ensuring that their food is safe, how they handle the food, and also good nutrition, and how to take care of their food security issues in terms of the amount of food that they have in the house to continue feeding even their children who are at home. So the education is going on, and the National Task Force for COVID has included food security as a key component, and nutrition is included. And therefore, the plans that will be coming will have to have that component of nutrition so that there are resources allocated to it. So what we are planning as we move forward is to work with the Ministry of Finance to ensure that there are budget lines, as I've said, then ensure that the guidelines that have been developed are being implemented, and therefore that means there are resources allocated to that. The business community has also come on board and developed a strategy to ensure that they also contribute and support families that are affected by COVID. So that is basically what we have as a country. We know it's difficult to also deal with the locusts and the floods. The floods have subsided, but the effect that it has on the food security is really enormous. And therefore, there is need to ensure that we get support from the private sector and try and see how we can increase funding from our donors. But also what is most key is for the national and county government to ensure that they allocate resources to nutrition so that the activities that are planned can go on. That means that we have to implement the nutrition plan of action that had just been developed. And therefore, we would like to see that the activities are not affected as we move forward. And therefore, we must continue having our meetings closely with our partners so that we can mobilize more resources from all the sectors. So that is what I have for you today. Thank you.
Thank you very much, Gladys, and for sharing that. And certainly everything of the best in your challenges that you face, especially in the locust swarm that has impacted on the various crops in Kenya. And also to use this opportunity as an appeal to the international community to support Kenya as it tackles the effects of the flood, the current COVID-19 pandemic, and also the locust swarms. Our last panelist, and last but certainly not least, will be responding to a couple of areas in the form of a presentation. And she is Poncho Seboluane. She is the Senior Technical Advisor, Nutrition, Social and Human Development Unit at the Southern African Development Community, Setec. So Poncho, please share with us in your presentation how the Setec Secretariat is supporting member states to ensure nutrition remains a priority, how Setec has been facilitating the continued cross-border trade of food and agricultural inputs during this period, and what are some of the initiatives that Setec has undertaken to adapt regional priorities to ensure nutrition remains a focus during this COVID-19 pandemic. Poncho, over to you.
Thank you so much, Neil, and greetings to everyone. I just wanted to show my face as I introduce myself. I will then switch off the video so that then we don't get any disturbance. Let me start by thanking the organizers for inviting Setec to the webinar. It's a good opportunity to discuss pertinent issues of financing for nutrition in the context of COVID, but also beyond. So I will share briefly some of the initiatives that Setec has embarked on to respond to COVID, but also making sure that nutrition remains a priority during the pandemic and beyond. So what we initially did as the Setec Secretariat was immediately when WHO announced COVID as a pandemic, we converged at the ministerial level. And initially at the ministerial level, the discussion was more on how do we respond to the public health emergency. And to that effect, the original response for COVID was mainly focused on public health, and it was launched in April 2020. But within the nutrition sector, we saw an opportunity to immediately release a supplementary bulletin with regards to food and nutrition security, to also amplify the importance of mainstreaming nutrition, both at regional and national response plans. And that bulletin was released in April. And at that point, where we didn't have much knowledge and information at the extent to which COVID is impacting on nutrition, but we relied on the global guidance from Johns Hopkins, where it indicated that we're most likely going to see a 25% increase of acute malnutrition cases. And we used that as one of our entry points to advocate for nutrition not to be forgotten. But we also amplified the importance of noting that as nutrition, we have been experiencing triple burden of malnutrition in the region, in the Setec region, and we needed to make sure that we don't forget nutrition during this pandemic. And I'm pleased to say, if you look at my second bullet, through this advocacy at regional level, we've also seen partners at national level really working with government, including our government counterparts in the member states, coming up with solid national COVID-19 response plans that include nutrition and food security. So advocacy is quite an important aspect. But then we noted that in the Secretariat, we needed to have an assessment done to have an understanding on the impact, the socio-economic impact of COVID in the region. And at that stage in May, we then did a secondary analysis And this was mainly just looking at the reports, to be honest. But as nutrition, we also see an opportunity to really amplify continuity of essential nutrition services as part of the interventions that should be considered at the regional level, but national level, as member states put in place responses, especially that alludes to the socio-economic impact of COVID-19. And at that point, we made emphasis on continuity of nutrition services targeting children under 5, but also women of reproductive age, because these are the most vulnerable in our region. But then subsequently, we managed to tap into the disaster fund, which now has allowed us to go deeper in our analysis. You'll see this nice pictorial depiction, which is an inception report of an in-depth Setec analysis on the impact of COVID on food security, on nutrition, and on livelihood. So this assessment is now ongoing, where we will be able now to really contextualize and come up with context-specific responses for nutrition. And the questions we are asking here in relation to nutrition, we're asking how individuals and households are adapting to ensure dietary diversity even during COVID, as one of some of the questions, but also how nutrition programs are being adapted to respond to COVID. You will remember that some of the responses had been to scale down on gatherings, which has also affected how nutrition services are accessed. So we're also going to now trying to understand how better do we ensure continuity of essential nutrition services through this analysis that is underway. And hopefully we'll have the results by end of August, September, to now have a position of beyond COVID, how do we better respond? The second last bullet, we've also re-looked at our nutrition budget. And in our nutrition budget, we've repurposed the nutrition priorities. And we have focused on remote monitoring, where some of the budget has actually been fixed into making sure that as food security indicators are being collected, nutrition is also mainstreamed. Some classical example in Mozambique in particular, through this monitoring system, they've included indicators like dietary diversity for children and minimum dietary diversity for women, so that then we start to have a sense. And this is part of the annual vulnerability assessments that countries in the region conduct. So these are also some of the opportunities that we have embarked on during COVID-19. Last but not least, and I will elaborate, with as nutrition sector, and I think some of the presenters have indicated that we need to look beyond just the health sector. We need to look at the opportunities across different sectors. And case in point, in the education sector, where we know that with the closing of schools, we've seen most of the school-age children really missing on one of the primary interventions, which is the school meals program. And in the Setec Secretariat, within the nutrition section, which I lead, we've looked at the opportunities of amplifying the importance of school meals program. And two things that we've done between May and June. Firstly, was we did a secondary cost-benefit analysis of school feeding programs, but not only on health and education, but we expanded it for its benefit to social protection, even for household level, and also the local economy. And that piece of work was presented on the 9th of June to our government counterparts in the education sector to showcase some of the opportunities that we can get from school meals program, but not just that, also indicating the importance of finding mechanisms of expanding this program even during COVID-19. And I'm pleased to say most of the member states in the Setec region has really tried their level best to expand their interventions even during school closure by offering take-home rations, which has really been one of the key interventions that we're grateful for. So during the platform where we shared some experiences, We actually generated a lot of good practices and lessons on school meals program during COVID, and I'm currently working on a 2-pager best practice document for Setec, which can be widely shared once it has been approved. Still on this slide, one of the questions that you raised, Neil, was how has Setec managed to ensure continuity of cross-border transportation of food and agricultural inputs? And I must say, this is one of the best good initiatives that Setec really undertook earlier on when they launched the regional response. You will see a little chart there at the bottom. We basically came up with the regional harmonized transport guidelines. And these guidelines, it came with a list of essential commodities that we said, even during lockdown, these are the key essential commodities that needs to make sure that they are fast-tracked to move cross-border. And these included food, these included agricultural inputs, and obviously medical supplies and equipment. And what has now evolved through the guidance document for transport was that we recognized blockages at the borders where the truck drivers are now being tested, and we have amplified it by coming up with what we call a corridor tracking monitoring system, which interlinks which can track the truck as it moves from one end to the other, but also it carries the health information of the driver specifically to COVID, with the intention that when a driver leaves South Africa and goes to Zambia, his results can be clearly seen on the system, and he doesn't have to go through a second round of interventions, meaning that we want to avoid blockages of food being stuck in the borders. This hasn't worked perfectly well, but these are some of the initiatives that we have embarked on at the Secretariat level. We can move to before moving to the next slide, one important aspect, and I think I need to share with you, is how we've continued to mobilize resources during under normal circumstances for nutrition. At the regional level, there is nutrition sensitive regional agricultural investment plans, which really has helped us to mobilize donor resources. And I'm pleased to say nutrition, through that initiative, nutrition has been amplified regionally and has translated to some priorities even at member state level. The second question, as I was preparing for this meeting, Neil, was how the Secretariat is really tapping into the fisheries and aquaculture sector, mainly because we know that fish is one of the key commodities that would benefit us nutritionally, but not only nutritionally, economically. And I thought I should share with you some of the initiatives without necessarily wasting a lot of time, was that at the Secretariat level, I'll just touch on three areas here. We are busy engaged, on the second bullet, engaged with the Africa Development Bank on looking at financing mechanisms to support member states to strengthen the small-scale fisheries and aquaculture initiatives. And this phase is actually at an advanced stage, which hopefully it will help expand our food basket. And here we're saying, as the Setec Secretariat, we need to go beyond just looking at the cereal-based food basket, but to have a diversified basket and tap at opportunities that will expand that food basket, including fish and other food commodities in our food baskets or food balance sheets, if I may say so. The other interesting thing I wanted to share with you is that, which is the second last bullet, we've been working, we have an aquaculture and fisheries expert in the Secretariat, and he has been really developing a series of best practices lesson on small scale fisheries, which covers building resilience and how to adapt to climate change, including COVID-19. And these best practice briefs have been shared widely, and these are some of the initiatives that we are taking to scale. Last but not least is one of the most important initiatives and is underway, where we're looking at profiling the regional aquaculture value chains with the aim of developing a business case. And one of our first webinars is taking place tomorrow, where the member states together with the experts will be reflecting on how best to build a business case, looking at the context of the aquaculture value chain in the region. So I will pause here. One in closing, I must say the member states have really tried their level best to adapt their nutrition programs and to ensure continuity of services in the region. And by doing that, it has made sure that nutrition becomes still a priority within the context of COVID, and we continuously discuss it. And we have also looked at different webinars. For example, just last week, I was part of the webinar where as Setec, we really emphasized on the importance of protecting infant and young child feeding, even during COVID, where we've seen opportunities for the industry to push through breast milk substitutes. And such platforms are there for us to really continue advocating and amplifying the importance and relevance of nutrition in the region. I will pause here and thank you for the opportunity to share this. Thank you.
Thank you very much, Bonjo, for that excellent presentation. We've taken a little bit more time than we had intended with the panel discussion. So we left with just over 10 minutes to attempt to address some of the questions that have been asked. And let me just say that they are really all excellent questions. The questions point to, what is being considered to be the important issues around financing, issues around how governments prioritize nutrition and how that is reflected in their plans and in their budgets, and also questions around how COVID has obviously impacted on nutrition budgets. And very important issue that was also raised is, do governments view food security and nutrition differently? A lot of the responses under the COVID-19 programs have referred to food security. Very important question that Gerda asked is it the same, food security and nutrition? And then there are also lots of very good questions about governance arrangements. So countries that have decentralized systems and where nutrition implementation programs happened at a county level or at a district level, how is that managed at an intergovernmental relations way? So I'm going to ask the country representatives on the panel to, in just less than a minute, and I'm going to become quite strict with time, to address the question on the financing. So has the country, here we're thinking of Mauritania, Kenya, and Lesotho, who's on the panel, has the country made available additional resources specifically to provide for food security and have budgets that are geared towards nutrition programs? Have those been protected and have those been increased? And where did your government find those alternative funds? Come from donors? Did it come from reprioritization? Or did it come from any type of alternate fund that has been set up? So let me start with Mauritania and ask Abbas if he wants to go first with the question. Thank you.
Merci beaucoup. Donc, je vais peut-être récupérer un peu plus de temps par rapport à ma présentation parce que je pense que j'ai été à peu près dans le temps. Alors, non, plus concrètement, moi je pense que ce qui est fait à notre niveau, c'est qu'avec un certain nombre de partenaires, Et j'ai fait mention de nos partenaires classiques tout à l'heure, mais je pense aussi qu'on bénéficie un peu du parapluie des fonds arabes. Et je pense que dans les semaines à venir aussi, on aura des formes d'appui pour le financement de la nutrition qu'on souhaite avoir de ce côté-là. Mais ce que je souhaiterais dire, c'est qu'un certain nombre de partenaires nous demandent déjà de leur faire une évaluation de l'impact du Covid sur le niveau nutritionnel de la population. Je pense que c'est quelque chose qui est nécessaire à faire, mais aussi qui est difficile à faire dans la mesure où l'impact en termes de temps, on n'a pas encore de retour d'information, mais on a déjà la semaine dernière identifié avec l'appui du système à nous avoir le retour d'information. Et je crois qu'on a un certain nombre de partenaires qui demandent justement donc cette information pour essayer d'identifier l'apport au niveau de l'intuition. Je pense aussi que ce qui est bien, parce que j'ai vu tout à l'heure une question sur le financement et l'efficacité de la gouvernance en période Covid, je pense que pour le cas de la Mauritanie, pour la gestion des fonds, on a mis en place donc une commission de gouvernance composée de l'ensemble de la société civile, des partis politiques, de l'institution de la société civile, des partenaires au développement qui elles, gèrent un peu tous ces fonds, y compris les fonds domestiques. Et ça amène bien naturellement nos propres partenaires à être témoins de l'utilisation de ces fonds. Dernier point sur lequel je pense que ce qui est le plus facile pour financer la nutrition, c'est plus l'angle de ce qu'on appelle les appuis budgétaires. Parce que comme vous savez que l'activité économique s'est rétrécie, et comme on demande aux pays de financer la nutrition à travers des ressources domestiques, et donc qui dit ressources domestiques dit naturellement entrée de ressources via le budget de l'État. Et comme l'activité économique se rétrécit, donc ces ressources-là diminuent, parce que l'activité diminue. Et je pense que le seul moyen actuellement pour financer de manière optimale la nutrition, c'est plutôt à travers des appuis budgétaires qui, elles, en termes de gestion, vont plus directement et ils sont de mobilisation plus facile pour la nutrition. Voilà ce que j'avais à dire à ce sujet. Et je vous remercie. Merci beaucoup.
Thank you very much, Abbas. Let me now turn to Gladys. And Gladys, if you can share with us some of the challenges that you experience in Kenya with the decentralized system, and first, I suppose, confirm that nutrition is a decentralized or devolved function, and what are some of the challenges in implementing a nutrition program that is decentralized. Gladys?
Yes, nutrition is decentralized in Kenya, but nutrition under education is still at national level. The challenges that we face are, there are many other competing issues that even if funds are allocated to nutrition, at some point you find that there is reallocation because we have to deal with the various problems that I've talked about. That is one challenge. The other is that the resources are not enough. When we look at health, for example, the many other health issues that we have to deal with will take away most of the funding, and nutrition is left with just some minimum. And there seems to be maybe a focus on dealing with the problem of malnutrition, and therefore the money that is available is more for procurement of commodities that will be used to help save lives. And some of the work is then left to our partners to support. So that one challenge. The other challenge is that the funding has kept going down, as I said, and yet the plans have, as much as they have been developed, the funding has not been allocated. But to the few counties that have been able to get support from our partners, we've seen that through advocacy, the counties have put in resources to the budgets that they have already developed in their plans. So those are some of the challenges, and it's not easy, especially knowing that we have several other issues that we have to deal with. But the government, national government, the president is committed to, as the big four agenda, what we focus on is food security and nutrition. And then there is universal health coverage, where we also find that there is nutrition and also education. So because of that commitment, then we are hoping that as we move forward, we can then ensure that we get more resources if advocacy is really enhanced, especially from our partners. Thank you.
Thank you very much, Gladys. So unfortunately, we have come to the end of the webinar. There are really, really excellent questions that we have not gotten to. Some of the questions would require more than just a few minutes to answer. Some would require more detailed responses. The organizations that are partnering on this webinar will be allocated each of the questions depending on the areas of expertise and mandate, and will be answering those questions through the emails that you provided us when you registered. So we'll get to those questions. Let me end with the following story. I was invited to a dinner several years ago by the World Bank's country director to South Africa, a woman called Ruth Gagia, who is a Kenyan by nationality. And Ruth and myself and some of the other guests, we were speaking about education, we were speaking about health, infrastructure, and about the importance as to why governments should invest in these various programs. And in the course of the dinner, we were joined by Ruth's husband, who was a retired professor, a very wise man. And he joined and he listened without saying much. And as the dinner was nearing an end, he said, you know, you guys speak about health, you speak about education, you speak about infrastructure as being the kinds of things that governments should be investing in. But I did not hear any of you speaking about nutrition. If governments, and he went on to say, if governments invest in nutrition, governments will meet many of their development outcomes. And nutrition will support improved education outcomes. Nutrition will support improved health outcomes. And that certainly struck me and got me thinking very carefully about the importance of governments investing in nutrition, and to also for that investment to be clear in their plans, clear in their budgets, and also, as Danielle had pointed out earlier, very clear in terms of how the funds have been used as part of measuring whether governments are achieving their desired outcomes. So let me leave you with that story. And once again, thank you to the panelists. Thank you to the partners that provided us with the inputs at the beginning. And thank you very much for Gerda for the opening introduction comments. Thank you very much also to all of you.
Mr. Moderator, this is Gerda Verburg speaking.
Hi, Gerda. Yes, Gerda, you want to come in?
Yes, please.
Yes,
I would like to make a few short closing remarks. First of all, thank you so much to the organizers and panelists and your able moderation. It was extremely useful, and all participants were able to learn a lot. Secondly, I think I would like to emphasize your story. Nutrition is the game changer on everything and on all sustainable development goals. The semi-final remark is, we as Sun Movement, together with NEPAD, we will reach out to ECOWAS and Sadec and other regional organizations to build on this agenda in order to build back better, so that countries can inspire each other also at the regional level. And finally, please think about your country commitment in the Food System Summit next year and Nutrition for Growth. This is also an opportunity to attract investors and donors to align behind your country and regional nutrition activities and plans. And we are there together with others to support you to do this. And for this, I was happy to join you. Extremely useful and interesting webinar. Thank you so much.
Thank you. Thank you for taking time off from your holiday to join us. Thank you very much. Thank you everyone that participated in this webinar. Thank you and goodbye.